In my case, I have GBS, Guillain-Barré syndrome. So the diagnostic journey was rather quick. I went one time in the hospital because I was feeling weak after being sick. This is a very typical thing, but they turned me away because they told me it was because of the sickness. But the next day, I went into the emergency with a wheelchair and was almost completely paralyzed. So by that time, the doctor already had the diagnosis of GBS and later confirmed it with a lumbar puncture. And the next day, I was almost completely paralyzed. So that is how it happened, very fast progression with Guillain-Barré. This treatment, it was rather fast. I mean, they don't have it on stock in the hospital, so I had to wait one day to start. It is a 5-day treatment with immunoglobulins, and the difference for me, fortunately, was big. I mean, I started getting better. Like on the 3rd day, I started receiving it, and without it, it would have been much worse. Like I would have much worse deficits. Some months after I went out of the hospital, I went again for a second round of IVIG, the doctor explained, to get rid of all the additional antibodies so I don't get relapse. Yes, this is an important thing because for me, I mean, for GBS patients, we usually get them because it's 1 or 2 rounds. So that is covered by our health insurance. We have a national health insurance. But when it comes to regular treatments or subcutaneous, that is not done. I mean, the people with CIDP get them maybe like 2-3 times a year, which is not enough. They get progressively worse. And I know the difference between people who get them like every 6 weeks subcutaneously, they have a very better quality of life. They are more active. They can do way more stuff. I mean, difference between the quality of life is immense. And it saddens me that it is so hard for people to. There are people who have money and can afford it, but it's like 10,000 leva or 5,000 euro every few months or something. Very few people can afford that, and that is just to have a normal life. It changes lives. I'm very happy about it. I'm very excited, and it's important to people to know that, because I used to donate blood before, not plasma. I didn't know about that. Yeah. I was a bit disconnected with my impact, and people have to know that plasma just not only saves lives but saves the soul of people, because it's not only about living, it's also about the quality of life. Благодаря на плазма донорите, and happy International Plasma Awareness Week.